Welcome to the Zelos podcast. I'm your host, Rocky Snyder, and this week I invite Kevin Morley on the show. He's one of the few professionals in the field with actually a doctorate in athletic training. Works for the Nashville Predators, and instead of just athletic training, we're going to dig in a little bit deeper all about CBD in the NHL. Be sure to follow us on Instagram at Rocky_Snyder. Click that subscribe button and enjoy the show. Kevin, I'm stoked to have you on the show because you have a unique degree. I mean, I'll say unique because, like you said just before we recorded, that it's relatively new in the last 10 years. You have a doctorate of athletic training. Now, right. At one point in time, athletic training, you needed a bachelor's degree, and then you can hang that on the wall and start off. But now, like my daughter is going through a 5-year program, getting her bachelor's, but then on to a master's for athletic training. Now, some people have said, that may not be the best thing, because when you get out with your master's, you've paid all this money for an education, and what kind of career path can you have? But a lot of times it's low paying salaries. So I want to talk about that. But first, you must have just this passion and pursuit of knowledge to go the distance. I mean, what got you to say, I'm not satisfied with a master's, I'm going for my doctorate?
No, I don't think I have a passion. I think I'm just a little crazy, honestly. Yeah. And I'll tell you too, is that my mother was a collegiate professor and raised 2 kids. And my dad's he's retired now. He was a high school teacher. And my mom was at a Central Connecticut State University in New Britain, Connecticut. And she was teaching, she had a master's degree. And she was on this 1-year appointment because she didn't have a terminal degree. And so they came to her and they said, Vicky, we're just going to renew this 1-year cycle every year for the rest of your life, because you teach these classes that no one else in her department can teach, but we can't put you in a tenure track position because you don't have a terminal degree. And she said, okay, well, I guess I'll just go get a terminal degree. So at 40 or 41, my mom started a PhD at the University of Connecticut. And for, I can't remember now, it's been too long, 4, 5, 6 years, however long it was. She was teaching full-time at Central, raising 2 kids and driving back and forth to Storrs, Connecticut for however many times a week for however many years. And so, so I joke that I didn't want her to have the only doctorate in the family, which is really not true at all. But I think it was proof of concept that if she could do that, the challenge that I was embarking on certainly was not easy by any means, but was certainly less of an academic commitment and less of a time commitment. And so, I felt like, we're privileged in, the world of pro sports is a small one, and it's not for everybody because of the time commitment and the travel, and a lot of people don't want to do that. It has nothing to do with proficiency or skill or intelligence. That this life is not for a lot of people, and I understand that completely. And so, that said, this is something, that my family and I have committed to for a long time. And so I felt, that there was an opportunity for me to further my education. And if there's another degree in my field, I didn't really have a great reason why I shouldn't have it. And so I was able to secure some scholarship funding. And so it wasn't even all out of pocket. And I felt like, I found a program at FIU that really spoke to me, and the faculty spoke to me, and the program director, Jeff Conan, has been a friend, colleague, mentor, depending on the day, for, a while. And so it was, just kind of the planets aligned, I guess. And again, I don't know if I think I'm probably just a little crazy. And I think my wife's a little crazy for really letting me do it, because it was, a lot of time at the computer after dinner when, I don't have a ton of time during hockey season, and we choose to spend it as a family. And there were times when I had a Zoom that I had to go sit down to, or go write a paper or do a business plan or whatever. And so it was one of those things where it's like a rite of passage, right? Where I say, I'm really glad I did it, but I'm really glad it's over.
Sure. Well, so what was involved with getting your doctorate in athletic training? I imagine there was some research. You just mentioned business plan, which kind of that struck me as somewhat of a surprise, but what encompassed all of it?
So the program at FIU is obviously the only one I can really speak to with great knowledge. Is that the program at FIU has 3 kind of main tenets or pillars. So one is FIU, by definition, Florida International University. International University in Miami. There's a tremendous amount of Latin American and Hispanic influence in Miami, of course, and at FIU as well. And FIU is a monster institution. And so the 3 pillars are the globalization of athletic training, education, and entrepreneurship. And so and what's really cool about the program is that, it's firm relative to these are the classes that you take. These are the classes, this is the order that you take them in. That's really not up for discussion. What is up for discussion is at some level what you do in those courses. So for example, if there's a scholarship track, right? Where there's, I don't remember now, maybe 3 scholarship classes. And, in internal to those classes, there's projects, right? There's papers and presentations and meetings and all the things. And, so what you do, you choose your topic largely. And so if we're talking about, different learning styles, as an example, if you want to go and practice in a high school setting, and perhaps a lot of athletic trainers in the high school setting might teach like health or anatomy or a sports medicine class. So, maybe, developmental learning over time might be really interesting to them. So maybe your scholarship class, you're going to identify, you're going to kind of morph your project load to focus on those types of things because it's interesting to you, which is always easier to work on. And it's probably going to help you in your job when you're done. And that's the whole point. And so that for me, other than having kids, that's not my jam, right? Like that's not super useful for me in my paradigm. So I might not, or I wouldn't choose a project like that. And so there's an entrepreneurship track, as I mentioned. And so there's, there's talk of, private practice athletic training, which is totally a thing. And, there's direct access to athletic training in not all states, but many states, similar to physical therapy. A lot of places you'll need a referral from a physician, and a lot of states you don't. So athletic training, we have a very specifically defined scope of practice, and we have licensure in 49 states, the holdout being your state. The remaining 49 states have athletic training licensure. And so, there's a very specific protection of, my title and my skills and my scope of practice and what I do. And so if I wanted to open, Kevin Morley Incorporated and start treating patients from an athletic training perspective tomorrow in Tennessee, I could do that. And so, but we're not taught how to do that. And I imagine you're undergraduate, unless you chose to have a business minor, you weren't taught like how to run a gym and how to manage that and how to malpractice insurance and like all those things, right?
True.
And that's your life. So there's pieces of that too. And so if I wanted to open a performance center with you, and we're going to partner, and I wanted to open a performance center with you, then the business plan could be, Kevin and Rocky's Performance Training Incorporated. And so I could structure the whole business plan around that and then flip it when I'm done and turn it into an actual business. And so that's why it was so useful for me. And in truth, I do have an LLC. I'm not planning on hanging on a shingle. I don't have time to do that right now, but it really opened my eyes, kind of in my early to mid 40s at the time, it opened my eyes to, really all the different directions you can go. And it's funny because, I got certified 24 years ago almost now. And so of course, when I finished undergrad, athletic trainers run high schools, athletic trainers at colleges, universities, athletic trainers at pro sports, maybe at some level, some PT clinics here and there, but that was about it. And now like I could go on for days. I had a friend that worked in a Frito-Lay factory. I have friends that work for Amazon. I have friends that work for insurance companies. And so the spectrum of where athletic trainers sit in this whole healthcare delivery system is so broad and so wide, certainly broad and wider than it's ever been before. So this gives people an opportunity to work on a doctoral degree, be able to say, I have a doctorate level education, and, and this is what I studied while I was there. So it's pretty cool, and again, all the programs are a little bit different. I think they're all, great for their own reasons. FIU was the one that really worked the best for me.
Curious though, like your friends that are working for Amazon or mega corporations there, do they still maintain the title of athletic trainer, or do they have a different title? I'm just side note there, curious.
Yeah, I think it's very, actually Boeing has a really interesting program, and I believe they call themselves athletic trainers. My name is Kevin, I'm an athletic trainer, but I think that their title for Boeing, is more, they do a lot of soft tissue stuff. And there's some really, I don't know if it's the laws of Washington or it's a Boeing thing or whatever, but so what they call themselves, I can't tell you. My friends who I have a couple of different friends actually who work for Amazon in a variety of different roles. Whether it's wellness consultant, sports medicine, that part I don't know. What I can tell you is that, Amazon has made a commitment to, and this is not even Amazon specific, but, a lot of corporations are hiring athletic trainers, physical therapists, massage therapists, strength coaches, psychologists, counselors, because they said, well, there's so much time lost if somebody, take the workman's comp part out of it, but if somebody has back pain or whatever it may be, maybe they hurt themselves, they fell and they broke their wrist walking their dog. Well, we're going to give them release time to go to PT or OT, whatever they're doing for their broken wrist. Well, if we can do that in-house, then instead of them being gone, they're taking a half day. They just took off 4 hours because they have to go drive there and whatever. Maybe they live in the Bay Area. It takes 3 hours to get anywhere. And so now if I have an athletic trainer, PT, OT, whatever it may be in-house, well, this is great. Send them downstairs. They see Rocky for 35 minutes, get all of their treatment done, and they walk back upstairs. And now they've lost 35 minutes or an hour of their day instead of 4. So it's pretty interesting to see the direction that the profession has gone, because there is so much opportunity. I think it was just athletic trainers saying, oh, I can do that. Oh, I can do that. Oh, I can do that, right? It's not just like ankle sprains and, and shoulder pain with pitchers. Like it's a pretty, we've done a good job, I think, as a profession of broadening, our, the perception, because it's not your perception, it's actually the truth of what we can do as a group and as an organization.
That is so refreshing to hear, because I've just been seeing this pigeonhole. And
Sure.
Maybe, you just widened it for me to see that it's not just sports and, like you say, high school, college, or pros. There's so many other opportunities. But okay, so curious, did you have to do a dissertation for your doctorate?
I did not. There's a culminating experience that's a capstone project. And that is one that is very, very, well, I don't want to say loose and flexible, meaning there's no standards. I want to say loose and flexible, meaning there's firm standards, but you can really morph it into whatever really speaks to you. And so, as an example, one of my classmates, she's from Puerto Rico, and she works in South Carolina now, but she was working in Miami at the time. And she was really, really taken by the lack of athletic training education in Puerto Rico. It's a small island. There's not that many universities, right? Like I'm not surprised to hear that. But she said, as a native Puerto Rican, I know that there are people that want to do this and want this knowledge and can't afford or just choose not to leave the island or whatever the case may be for a variety of reasons. And so she put together this athletic, she didn't certify anybody, but she put together this athletic training symposium in 2 languages in Puerto Rico, conducted it partially in real life and partially via Zoom. And I thought it was really cool because it was so impactful for her and for her community. And so that wasn't anything any professor would have said, you need to do this. No faculty member is ever going to come up with that project. So there's, the spectrum of kind of how people approach that was really, really interesting. I was part of a group that I think, as I've mentioned to you before, I'm really, really interested in CBD and cannabinoids. So a little bit less the cannabis space specifically, but more the cannabinoids. So if you think about cannabis, obviously as containing THC, hemp is essentially cannabis less the THC. So hemp in its component phytocannabinoid CBD, it ends up alphabet soup a little bit, right? CBD certainly is the one that everyone's the most familiar with. And so there's lots of really, really great, there's some bad actors in this space, of course, I'll be the first to say that, but there's some really, really awesome companies that really, really, really want to help people and are helping people, which I think is really cool. And as an aside, I think we're just a very over-medicated society. I think we take way too much Ambien. I think we take way too many antibiotics. And, so that's a bit of a soapbox where it's probably not a great opportunity because I could talk about that for a long time, but I won't. And so, in the CBD space, I saw a lot of people using it. And I said, well, God, I don't really know how this works. I know CBD comes from the cannabis plant, but that's all I knew. So that was part of the, really the kind of kick in the pants that got me to start this doctoral program was I said, well, I'm probably going to learn about this anyway. If I can parlay this into some sort of educational program, this doctoral thing sounds pretty cool and I'm a little crazy, so I'll probably actually see it through. Maybe everything's going to come together and we'll coalesce and turn this into something cool. And so there's a group I was, among a group of DHE students at FIU who partnered with a CBD or cannabinoid company and got some funding to really start some research. And so
what did you find out?
Well, we're not sure yet, unfortunately. And I hate that's the most researchy answer to any question, right? It's we don't know, we need more research. What I'll tell you is that the biggest indications that people choose to use at times cannabis, but again, more specifically CBD, are pain, inflammation, anxiety, and disordered sleep. And now a lot of times those go together, right? Because if I have pain, the hockey game, we were in Toronto last night, somebody gets hit in the foot with a puck, well, he has pain. So now he has pain. Maybe he's worried that he can't play tomorrow because now we're playing Montreal in a few hours. And so now he's worried because maybe his spot in the lineup is in jeopardy, or he's not sure if he's going to be able to play. So now he's got pain and anxiety, and he's also got inflammation because he just got hit in the foot with a puck that's going 100 miles an hour. And well, guess what? We got into Montreal at 1:30 in the morning, and now we're up and trying to start our day and having another game today and then fly back to Nashville tonight. Well, now his sleep schedule is disrupted because he's all hopped up on adrenaline anyway. And then, our circadian rhythms are kind of screwy because of course we're traveling relatively late into the night. So he's got all the things, right? Like all the things are standing in his way. And so those are the biggest reason. Those are the big buckets. And so people in my program, we said, all right, well, let's attack these. And we were all in isolation, right? So we obviously were information sharing, but everybody's project is a standalone project. And so my project looks at, and we've hit a bit of an IRB roadblock, unfortunately. So it's actually, I have graduated because I fulfilled the requirements for my, kind of my portfolio in my capstone project. The end result from a research perspective remains, TBD, but because it's important to me, I'm certainly going to see it through, and we're working through the IRB process right now. We're looking at sleep. And so there's, a lot of people say, well, I take CBD and it helps me sleep. But what's really interesting is that a lot of people say, well, and you can take out CBD and insert melatonin too, right? People say, oh, I take melatonin, it helps me sleep like a baby. And other people say, I take melatonin and I thought it did absolutely nothing, total waste of money. I will never take it again. Which is interesting and kind of frustrating from a medical perspective, because it's like, well, we think if I give you 2 Tylenol, I know what's going to happen. If I give you 5 milligrams or whatever of melatonin, well, you actually don't know what's going to happen, which is frustrating from the perspective of the clinician, as well as from the perspective of the patient or the consumer who's buying this melatonin or CBD or whatever. And so, what we're trying to look at, kind of CBD again is the cannabinoids that people know the most about are THC and CBD. And so after CBD, if we stay away from the THC, if we stay on the phytocannabinoid side, the next wave of alphabet that you are hearing about, I would imagine, are CBN, CBG, and CBC. And these are all just component molecules. So if you take the cannabis plant, there's been over 100 phytocannabinoid molecules isolated within the cannabis plant. Over 100. I know it's over 120. I don't even know where it is now. Now, it can be very tedious and difficult and expensive and time consuming to isolate all those things. So you're not going to have 100 different choices in the cannabis space or in the cannabinoid space, but there's a lot of choices is my point. And so CBN helps a lot of people sleep. CBN does not help everybody sleep, but it helps a lot of people sleep. And so because of this environment that I work in and live in, where we're up late, and sometimes like when we're in Canada, we are on hockey night in Canada, sometimes our games are 8:15 puck drop. I mean, it is late. And then by the time you do all of your treatments and everything after the game, and then you have to clear customs and get on a plane and fly home. I mean, we're all over the place, literally, right? And I know you chatted with Kyle Moore, which I listened to from Vegas, and he's a good friend. And I think he shared some of the same challenges. And so regulating people's sleep, I mean, rest is a weapon. And so, sleep is the ultimate performance enhancing substance that's free. And you have at some level, nearly total control, right? Like you're in charge of when you go to bed, largely.
Sure.
Now, there's a variety of things that I talk to people about. And when people, when we're just chatting and people are, and a player or coach or somebody says, oh, I can't sleep and I'm having such trouble getting sleep after games. I don't push anything. I view my job as an educator. And so, and a bit of a guide, right? And I'll say, okay, well, what have you tried before? What's worked for you? What's your wife, spouse, partner telling you? What are your teammates telling you? Because that's ultimately our crowdsourcing, right? That's our evidence-based practice, is just asking friends. So they'll say, oh, well, my buddy tried melatonin. Cool. Maybe you should try melatonin. There's the NSF part, which is a separate conversation, but okay, melatonin helps a lot of people. Try it. That's the first words that come out of your mouth. Sure, try melatonin. I don't know if it's going to work or not. The likelihood that it hurts you, I think, is very low. The likelihood that it helps you, I don't know. Give it a shot. And so as we have that conversation, we also talk about, breathing, and we talk about blue light, and we talk about meditation, and we talk about yoga. And so we talk about a lot of different things. It's not straight to pills. It's never straight to pills. It's a behavior modification that oftentimes will be helped, but it's always kind of a collaborative process where, what are you willing to change too? Because if you've been in the NHL for 10 years and you have 2 cups of coffee before every game, and it gets you really juiced, and that's important to you, and I ask you, are you willing to change that? And you say no, well, like, it's kind of then the conversation's over, right? Like, that's a full stop, let's move on. So I might say, okay, well, you might want to consider that, but let's talk about some other options. And so it's a collaborative process for us. So this is a really long-winded answer to that question, but sleep has been really interesting to me, and so is CBN, because so many people have great results with it. And, and one of my crusades is to get people off of, prescription pharmaceuticals to get them to sleep. Because I think some people are truly, have sleep disease and require prescription medication. I'm not suggesting that that's not true. What I'm suggesting is that I think we've gotten a little fast and loose with it. And a lot of people don't need that. That's all I'm suggesting. And so CBN, what we're trying to look at is, there's a variety of different questionnaires that ask you about your sleep effectiveness. So you can get them, like if you have a Whoop or an Aura or something, oftentimes, you'll have the recovery quotient, and everybody uses different terms to describe it, right? So your recovery or your, rejuvenation numbers or whatever words you use. There's also a bunch of different questionnaires. So certainly we could go get Auras and put them on everybody and measure their recovery relative to how they slept after doses of CBN or not. And we have a company that's ready to make us a CBN product and a placebo product, no problem. There are also just some questionnaires that just ask you about how well you felt, or how long it took you to fall asleep, how well you slept, how easily you woke up, and your alertness on waking. One's called the LEADS, sleep LSEQ, LEADS sleep effectiveness questionnaire. There's a variety of them. And so We're trying to partner with some companies to put all of that together. And so as you would imagine, it's not as easy as you would like it to be. And so that's still in the works, but we're getting there, I think. We hope to start collecting data soon, but we're still working on it.
Well, and it is something that's so new. I feel quite naive in that industry or in that science. So I'm just one thing curious about, from state to state across the nation, do all the states approve of CBD products?
Yes.
I mean, THC may be completely different, right? We've got a whole bunch of states that are saying, yeah, you can legalize it, you can do this and that, but we're not talking about that. We're talking about the CBD products.
Yep. So hemp is legal everywhere. So the Farm Bill, which is revisited by Congress you'd think it would be on a normal cadence, and I don't actually think it is. I think they kind of revisit it when they feel like it, but I think it's every 8 to 10 years. It's not that regularly. So the Farm Bill governs a lot of things, as you can imagine, and I think it's the Farm Bill of 2018 is the last time they revisited it. And pursuant to the Farm Bill of 2018, hemp is legal everywhere in all states, all jurisdictions. And so hemp is anything that contains less than 0.3% dry weight THC. So you actually can have, I call it a touch of THC. And so, and yes, the answer to your question is yes, hemp in any formulation, whether it's the t-shirt that you're wearing or the pillowcase I see in my hotel room, or a product that, that you might take for a variety of different reasons, hemp is legal everywhere around the United States. It's legal in pretty much all of Canada, but I don't want to speak for Canada, although, I'm in Quebec right now. But so hemp is legal everywhere. And so I think that brings up the point that, and this is one of the things that I think is the most confusing for people about cannabinoid products, is this whole concept of, you'll see these terms isolate and broad spectrum and full spectrum. And so when you're buying, because people say, my friend, mom, partner, whomever used CBD for their shoulder pain or their sleep or their anxiety, it really helps them. I want to try it too. What do you recommend? Right? Like, I get that question all the time from different genders and races and ages and morphologies, all the things. And it's very overwhelming because there's so many choices. And I understand that completely. And I'm reasonably familiar with this space, and I find it overwhelming too. And so what I tell people is like, okay, let's just start from the basics. The same way you have a couple different choices in milk, right? Fat, skim, 2%, 1%, right? You have a lot of choices in milk. You have a lot of choices in the cannabinoid space as well. And so the first thing that I explain to people is the difference between isolate, broad spectrum, and full spectrum. And so And isolate is just that. So if you buy a CBD isolate, it's just CBD. That's the only thing in there. If you buy a broad spectrum product, right? If you just think about what the word means, like we're broadening the profile. And so a broad spectrum product is not going to have any THC in it, but it's going to have a variety of other components, terpenes, flavonoids that it might have. Often with the oils and stuff, you'll notice a lot of different smells. And we think about, a lot of the smells. What do we think about from an aromatherapy perspective about smells that are common, right? We think about blueberry, often lavender, right? And then and then we think of, a variety of different smells relative to, kind of excitatory smells, right? And then we think of a variety of different smells for cleanliness, oftentimes, right? The Carolina pine forest, right? So like pine and lemon, and so like linalool and pinene, and a lot of these different terpenes are involved in CBD and cannabinoid products as well. And then your full spectrum product is going to have that touch of THC. And again, for it to be considered hemp, it has less than 0.3% THC. And the reason why we care is because there's this concept called the entourage effect, which is exactly what you think it means, which is that all these things together work better. So this is the we're better together philosophy. And so CBD by itself may help a lot of people. CBD is poorly metabolized. And so oftentimes as a consumer, you're buying more because you have to take more oftentimes to notice effects. It's not hard to find. It's just not sold as much because people don't buy it as much, because patient experiences tend to be better with broader full spectrum products. Most cannabinoid companies don't sell CBD isolate or any of the isolates. Most of them sell either broad or full spectrum, and many of them sell only full spectrum products. Because if I'm a manufacturer and I'm selling water bottles, then I want to sell you the best water bottle possible, so you buy more of my water bottles. So if I know that I'm a cannabinoid company and I can sell you a full spectrum product which has a touch of THC in it, which is completely legal and still legally hemp, and I know that that's going to give you the best effect, which most people report, not all, most people report that the full spectrum product gives them the greatest benefit at the lowest dose. Well, that's what I want to do, because then people are going to keep coming back. And these products are not cheap. So we want to put them in a place where the companies want to put them in a place where they have, you want the minimally effective dose, but you want your effectiveness to be good. And so I usually just stop there. I say, based on what I've just said, some people, they're not comfortable with any THC on board. I understand completely. If you're not, then a broad spectrum product is for you. And there's plenty of them out there. If knowing that the THC component is low enough, there's no psychedelic effect, it's not going to get you high. If you're comfortable with that, then a full spectrum product is for you. And, and I just kind of stop there, and then, people, digest and usually come back a day or two later, and then we talk about tinctures versus or gel caps versus gummies versus vapes, and then timing and dosage and all those things. And I don't pretend to be an expert in this by any means. I've just spent a lot of time doing my best to educate myself, so so I can provide people some level of guidance, because otherwise, obviously you're just kind of Googling or DuckDuckGoing or whatever people do now. So it's a challenge, because it's a really, it is the wild, wild west at some level. Obviously the cannabis space is a separate space and even more complicated. And certainly, obviously, lots of different, legal issues there. So, the hemp space is easier for me to talk about because I'm constantly traveling, I'm crossing state lines, all the time, oftentimes international borders. And so, the hemp space is just a safer space to talk about.
And how has this rolled out within the NHL or specifically the Nashville Predators? I mean, there must have been some time, obviously consideration, a lot of communication, a lot of education, but I find it truly this a fascinating area to talk about because of the history of drug testing and performance enhancement and a whole bunch of other things, illicit drugs and so on within the world of pro sports. And now we're taking something that has been derived from it, that is not giving hallucinogenic effects, that is not on that side that you've just described, but it's more for a homeopathic approach or restorative approach, addressing the needs of the athletes. How did you win this? And it probably wasn't your individual crusade yourself, but just how is this rolled out amongst the NHL and the Predators?
So that it's tricky because NHL teams can only provide supplements that are NSF approved. Until very recently, there were zero CBD products that were NSF approved for sport. There are no longer zero, but there's a very small number. I'm positive I can count it on one hand. And so that has changed things. So as an aside, NHL players and other athletes take things that are not NSF approved all the time. I'm not going to pretend that they don't. I know that. And so my job, our dietitian's job, our strength coach's jobs is to provide them education. And the first thing I say to them and the last thing I say to them is the same. You're responsible for what you put in your body, period. That's the end of the story. Now, if you have questions about CBD, I'm happy to answer them as well as I can. I'm not recommending anything. I'm not providing you anything. I'm not selling anything. I'm not on a commission structure here. I'm providing you education and information. And so it's delicate for that reason, because the leagues all approach this very differently. And some leagues aren't testing for cannabis at all, and some leagues aren't penalizing for cannabis, and it's a non-issue. Our league is a little bit in a bit of a different position relative to, being in two countries. Obviously, I understand that basketball has a team in Toronto, but they're a US based organization, right? So baseball has a Toronto Blue Jays. I understand that. We spend a lot more time in Canada than other places. And so we also go to Quebec, and Quebec, is kind of oftentimes has some different policies, but Canada in general has, it's made up of provinces. Provinces have provincial governments the same way our states have state governments. And so the laws are very different from place to place. And so a one size fits all approach, it doesn't fit. And so I always come back to just providing education. And so if you have questions, I'm happy to answer them or do the best I can to answer them. If I can't answer them, I can find somebody who can. And you're responsible for what you're putting in your body. And then we just kind of leave it there.
And then your relationship with the team doctors in regards to education and so on. How's that kind of laid out?
So they, I know more about this space than they do. But they know a whole lot more about pharmacology and the physician's desk reference and their own medical practice than I do. And so, people, the same way you can go to, if you don't want to take a prescription strength anti-inflammatory, for example, Mobic, right, which is a very powerful, largely benign anti-inflammatory that helps a lot of people. But I have a lot of players that say, I don't like taking pills. I don't want to take prescriptions. I don't want to take an anti-inflammatory. I'm worried about my gut. I'm worried about this. I'm worried about that. I understand completely. I'm not a pill pusher. Neither are my physicians. We prescribe very few medications. And so they'll say, well, I don't want to take Mobic. I do have some shoulder pain, back pain, ankle pain, whatever, at times. I'd really like to take a CBD product. Okay, well, if you want to take a CBD product, again, here's some education I can provide for you. And if you're entertaining taking a CBD product and a Mobic, and an Ambien and a Lipitor, then we need to stop, push, not even push pause, push stop. And then we're going to talk to our clinical pharmacist and our team physicians in aggregate, right? So, so obviously they become very, very patient specific and situation specific conversations, but it's a very collaborative one because my team physicians aren't big pill guys and gals either, so we're, pretty reluctant to just kind of jump into the prescription medication space. And if that's other people's practices, that's fine. And that's their purview. For us in Nashville, we like to approach it a little bit differently. I have a fantastic dietitian who works with us on, a lot of different food related strategies that can obviously affect your blood sugar, your inflammatory, and your cortisol, and all those different things. So it's a really collaborative approach. That doesn't center around anything. It centers around the patient or the player. It doesn't center around CBD. It doesn't center around Ambien, and it doesn't center around beet juice. Although all of those things may come up in the same day. It's a patient-centered, patient-focused conversation.
Well, I'm really hopeful that you are not the only pin on the map when it comes to NHL athletic trainers and this conversation or this topic. Do you have other colleagues around the league that are starting to explore and educate themselves in CBD and how it might be a benefit?
I do, because the players are asking. And so, I think The same way if a player comes in and says, hey, comes into our gym, says, I use this training device or this training methodology when I was home in Prague for the summer. I want to learn more about it. Then our strength coach, if they don't know what that is, they're going to educate themselves about it so they can have a conversation about it and decide whether it's something they want to implement in their program or not. So yes, because our players are going to all corners of the world seemingly, on breaks and certainly in the off season wherever they reside. And so they come back with all sorts of different ideas and they have questions and they all talk. So the same way, my colleagues and I all talk, the players all talk as well. And their agents will talk and say, oh, well, this guy in San Jose tried this. Have you ever thought about it? And then they'll come into myself, again, strength coach, dietitian, team physician, and say, hey, and the San Jose guys are using this medication. Of course, I know the San Jose guys really well, so they're easy conversations. So the answer to your question is yes. A lot of my colleagues are spending some time at varying levels, based on the comfort level of, their team physicians and having those conversations, and the interests of those players. So yeah, it's something that everybody, it's not a secret. CBD, cannabinoids, even cannabis, like cannabis is part of our society. And so whether you choose to use cannabis or not is not important to me. What is important to me is that on the cannabinoid space specifically is that I can provide you some education about, what you can expect. And, I laugh because people say, oh, I took CBD once and it didn't help, so I never took it again. So, well, okay, that's fine. That's not really how it works. You don't need to take it for a year to notice a difference, but the likelihood that you take just one dose and you kind of hit the sweet spot is relatively low because there's timing issues and there's metabolism issues and what else do you have on board? There's methods of, the different formulations. There's a lot of things. And there isn't, what's frustrating for me as a clinician and as an educator is that there's very seldom one obvious answer. So we're going to start with, I would recommend if you choose that product right there, that seems to be safe to me, less the NSF stamp. If you're going to take 5 milligrams, try that for a few days in a row, maybe a week, at about the same time. You want to make it as scientific-ish as possible. And then maybe you go to 10 milligrams or 15. And so it's it's a start low and go slow approach that, you just have to be patient with and take your time and just see what works best for, for you and for your population.
I find it fascinating that it doesn't have a homogeneous effect across the spectrum. And we had a little conversation prior to the show talking about just that, but and the fascination that you have with that. Any kind of research coming out as to why that is? Why is it so individualized?
I can't say no. I'll say not that I'm aware of, because it's just such a broad footprint in terms of there's so many uncontrollables that it's difficult to say, well, it affects all men this way, all Asia Pacific Islanders this, so are there, racial genetic reasons? Maybe. I'm positive that I don't know. And I work with a fairly homogeneous population, right? It's all male. It's almost all Caucasian, a lot of, Northern Europeans, fair complected, I know what everybody's vitamin D is. Like, I have a relatively homogeneous population, and what they tell me now, again, I'm not providing them product. I don't necessarily know what they're taking or when they're taking it, but when we just have these casual, fireside chats, what I do know is that there doesn't seem to be anything really, really that predictable. And that's frustrating for everybody involved. And you just have to understand that going into it, the same way alcohol, in truth, like I understand certainly alcohol, obviously, BMI and those things obviously can have an effect. And obviously there's genetic things with alcohol, but I've seen plenty of people, about the same size, the same gender, about the same age, all those things. And, some guy has a fairly low tolerance for alcohol and some have a higher. It's probably not a great comparison because obviously some of that, you develop your tolerance over time. But I guess my point just from a reductionist perspective is that alcohol doesn't affect people the same way either. I guess I would just kind of leave it there.
It's so interesting. I mean, I recall my days back at the university, and this is in the mid 80s, shall we say, back in Massachusetts. Yeah. And the book, The Emperor Wears No Clothes by Jack Herrera was something that friends were kind of circulating around, all about the utilization of hemp products and so on. And here we are almost 40 years later, and it's actually becoming a reality and infusing itself into professional sports world. If you had asked me back then in 85, 86, I just would have said, there's no way, because I just figured with the powers that be, it just didn't make sense. But it looks like it's actually happening, which is it's really quite cool. And I'm just curious, your sources of information, where are they coming from?
So that's the wild, wild west too. And so that takes a lot of digging. And so the answer to your question is that I have a couple different Google alerts set up. And so I get every morning, I get my Google alerts, and I have, endocannabinoid system, CBD and sleep, CBN and sleep, CBN and pain, CBN and inflammation. And 80-90% of it is junk. Right. And so a lot of it is either just junk because it came from, a poorly, a non-reputable source. A lot of it is just very surface level kind of magazine articles. But the true research, it is out there. The challenge for me is that I'm not a biochemist. And so it becomes very, very chemistry, very, very metabolism focused, very, very pathophys focused relatively quickly. And I don't necessarily have the bandwidth to digest all of that. And so my sweet spot is there. I don't have like a favorite journal necessarily, because it all pops up, and I'll do some PubMed searches and Medline searches if I'm like looking for something specific. But also because I've become part of this, internal to the FIU program, we share a lot of research where I'll see a study and go, oh, that's really cool. Or in truth, I might see an article in Men's Health that's pretty well done that references specific articles, and I'll just cheat off of that guy or gal who wrote it. And then I'll go get that specific article. And so I'll let people kind of do some of the work for me. So it's hard because there's a lot of stuff that's not super scientific, but there is scientific stuff out there, and there's more coming. You just have to dig a little bit harder because it's not in the Lancet. It's not generally yet. It's not in the Journal of Athletic Training. It's not in JOSPT, but it is out there, and it's continuing to come kind of more mainstream, as you mentioned.
And of the handful or less than handful of products that have been approved, how recently were they approved? Has it been
months.
Over the last just months?
Yeah.
So the hope is that over the course of the next, say, 2, 3, 5 years, that number is going to grow substantially if it continues on this path.
Yeah, but that part's tricky too, Rocky, because getting NSF approved is expensive. And so, I don't have any products that are NSF approved. I don't have any beef with the NSF per se. The NSF is an agency that's trying to protect the consumer, right? To be clear, I get it completely. I want to protect the consumer too. My understanding is that in addition to like the initial certification process, there's ongoing testing, and I suppose there should be, right? Where they're doing batch testing periodically. And so they're having, companies are sending products in and things like that. I certainly am not an expert in how that process works. What I do know is that manufacturers are telling me that it's cumbersome and it takes a while and it's expensive. And so if you and I have, Kevin and Rocky CBD and we're crushing it, then why do I need to get NSF approved? Well,
yeah,
because a lot of the consumer space doesn't care. So NHL players care, a lot of other professional athletes care, a lot of people don't care. So do I think that it provides value? 100%. It provides a tremendous amount of value. And the companies that have gone through the NSF approval process, I think will be glad that they did it. But I also think that companies can be very, very successful without having done it. So yes, my hope is that, the Nashville Predators today are not providing any NSF products to our players. At some point, I really don't know. That's not my decision to make, in isolation, in a vacuum. I would be part of that conversation, certainly, but we're not having that conversation today. At some point, we certainly might. So over time, do I think there will be more products available? Sure. And do I think that teams will be providing them? Yes, probably. And is that in the more foreseeable future than ever before? Yes. But is that tomorrow? Yeah, I really don't know.
Yeah, and the Players Association, I'm sure they have a voice within, and I know you're not a representative of them, but I could see them being a source of encouragement to try to get more for their players.
Yep, exactly. Because they just want, they want their players, they want their alumni, they want their players and their alumni taken care of. And in truth, like that's my job. I take care of their players every day. That's literally my job. So So I do too. And so if I have more options to take care of their players, then that's good. If it's CBD, fine. If it's another manual therapy technique, that's fine too. So whatever it is, it's not important to me. I want to have, as many tools, literally and figuratively, tools at my disposal as possible, so I can make the best decision clinically based on the patient and the situation and their history and all of the things that kind of, encapsulate an injury pathology, wellness challenge. I want to have as many options as I can. If CBD or a CBN product is one of those, that's awesome. If it's not, obviously we'll pivot and find something else.
All right, and then with we're coming up to near the end of the show here, but I'm curious. We haven't even touched really, interestingly enough, upon a whole bunch of things that I normally do, but that's good too, because I love talking about the subject. And the fact that it's bubbling to the surface, percolating up is really quite encouraging. But you had quite a stint with the New Jersey Red Devils, and well, first of all, you grew up in Connecticut. That means you're on the Mason-Dixon line when it comes to Northeast sports. So were you a Bruins, Whalers, Devils? Where was your alignment when growing up with hockey?
So I grew up a Hartford Whalers until they left, which I think was like 92-ish. Does that sound right?
Yeah, about that.
So I was Whalers. My dad was a huge Giants fan. This is like Phil Simms, Lawrence Taylor Giants. So I was kind of by default was a Giants fan, although at times I became kind of contrarian and became like a Miami Dolphins fan because I thought Dan Marino was cool for Mark Duper, So mostly Whalers, Giants, and UConn basketball.
All right. So you didn't switch affiliations like the Islanders or Rangers?
No.
Thank God. All right. That's good. But okay, so moving from New Jersey to Nashville, what did you take with you along the way to keep you successful? What was it that you gleaned or got from your time in New Jersey and moved into Nashville? Just curious.
Yeah, so I was with the Devils in a variety of different roles, starting at the American League level and then as an NHL assistant, as an NHL head. And I was with the Devils for 14 years. And so, so my life changed a lot during that time. My practice grew exponentially during that time. And I got to work with some really, really awesome people. So I certainly broadened the scope of obviously my skill set and just kind of my general education and kind of, turned into, kind of tried to solidify my profession in terms of like, this is what I believe about the body. This is what I believe about sports. And this is what I believe largely about, treating people. And I don't mean treating people like how I adjust their ankle. I mean, like how I treat them, like how I speak to them and how I, interact with them. And moving from New Jersey, which obviously is a geographically, obviously a very, very metropolitan market. Nashville is no slouch, and Nashville is growing like crazy. But Nashville certainly, obviously, is a smaller market, relative to population, of course, and population density. I think it took, a lot of the benefits of working in New Jersey were obviously great access to wonderful medical services between New York City and obviously everyone in New Jersey. It was a wonderful, wonderful corporation. The Devils changed a lot while I was there. They were under one ownership for quite a while. And then a portion, I can't remember now when, the Devils changed ownership at one point and were bought by, a bigger company that happens to also own the Philadelphia 76ers. And they own Crystal Palace, which is a soccer team in London. They own a gaming team, venture capital. It's a big company. And so they had, so what comes with that is, a lot more opportunity. And I was involved in some different VC conversations and some things like that, which was kind of cool about emerging technologies that, maybe smaller markets might not be in a position to look into. And so, I took the New York City, awareness of the world and of the medical delivery system. And not that that's better because, some things are wonderful and some things aren't. But it was a really cool opportunity to be in that medical environment and just like social environment for quite some time. And so we bring that to Nashville. We partner with Vanderbilt University Medical System, which is, one of the biggest medical systems. I mean, it's certainly the biggest medical system in Tennessee, the Southeast, between us and probably Emory would really be the closest, and maybe, WashU and St. Louis. But I mean, it's an absolutely enormous medical center, all multi-specialty, everything. And it's an academic medical center. So it's just growing all the time. And we have some awesome, academic programs, and any specialist I've ever needed, thinking like, oh, you're in Nashville, you're in Tennessee, it's a smaller market. There might not be as many people there. Like there has not been one thing where I've said, oh, I need this specialist and we don't have it. And so that's been really exciting. And that didn't surprise me, to be clear. It's just really nice to be able to have that. And our partnership with Vanderbilt has just been absolutely over the top. It's longstanding and it's been fantastic. And so I think, from New Jersey, I guess to answer your question, I took kind of my clinical and professional approach in terms of how I work and collaborate with my colleagues. And this is my hockey family, right? These are my hockey. It's pretty much, it's not all men, but it's mostly men. So these are my hockey brothers and sometimes uncles, or now it's sometimes my little brothers and kids, nephews, I guess. So, learning how to fit into a system like that, that's obviously it's dynamic. It's always changing. People are coming and going. We're getting bigger. At times we're getting smaller. And so that's probably the thing I learned most from, my time with the Devils, is just learning how to work within a system like that.
Oh, that's super, man. This has been a great conversation. I love it. I love this podcast, not just for the pure joy of learning from the people that come on the show, and you are no exception to that. I love it. I'm intrigued by what you're doing and the future that's coming. That's with everything we've talked about in the NHL. So I can't thank you enough for coming on, Kevin. This has been great.
Thank you for having me. This has been really fun. As I was looking at your guest list prior to us getting together, we've been going back and forth for some time now, and I looked at your guest list, and there's, this whole performance medical sports space obviously is so small. And, I knew Bill from Carolina, who you had, quite a while ago, and I've known Mike Boyle for years, and even just more recently with Devin McConnell and, with Kyle Moore. But what I thought was so cool, I listened to Kyle and Devin because they're my friends. I knew what they were going to say, but I listened to them because they're my friends and I wanted to support them. But, just recently I listened to I think her name is Tracy from USA Surfing.
Yeah, Tracy Axel.
Which was super cool because that obviously is not my environment, and so there was a lot of things she said that didn't surprise me at all. And there were some things where I was like, oh, wow, that is such an interesting perspective because I don't live in that environment. So at some level, I live in like the unstable surface environment, not to the level that she does. But our locomotion is different than, running on a basketball court or a football field or whatever. So I think it's been fun to be able to have this conversation with you and to be a part of it because, your guests, you have, as much as you're, this is a sports medicine, sports performance, focus, each focus has been so different. And the folks from Springfield College that you mentioned before, from an academic perspective, were super cool. And you've talked about Springfield quite a few times. And I have to say, I didn't go to Springfield. I was actually recruited to swim at Springfield. And I chose not to go there only because I had to get out of New England. So I'm like a half-breed Springfield alumni because it's a very special space. And you're right, there's not very many people who don't have some degree of separation from Springfield College. They've been doing a lot of great things there in our education space for a very, very, very long time.
Yeah, it's honestly, Springfield College is the Kevin Bacon of strength and conditioning.
It is. It's wild. I totally agree.
So cool. Oh, this has been great. Kevin, thanks again.
And that's a wrap for this episode of the Zelos podcast. I want to thank Kevin and the Predators for coming on and just having a great conversation. Hope you got as much as I did out of everything he shared. And I guess we'll just see you next week for another fantastic episode of the Zelos podcast.